1,000 people were arrested for marijuana charges in 2009. That is over 800,000 families that were being ripped apart by the United States government that has decided marijuana was a highly addictive and damaging drug and is a Schedule I drug. Approximately 88% of these arrests were for simple possessions. These Americans were arrested for simply possessing a natural plant that has been a direct cause of any known death, that has never been a direct cause for any known death. Uses of this plant can be positive or negative, just like any other drug. A Schedule I drug is classified as having no known medical use and a high potential for abuse. I'll provide you with the facts necessary to persuade you to become pro-medicinal cannabis. Throughout history, cannabis has been used for medicinal purposes and recreational purposes. Cannabis medicinal purpose in the past included appetite stimulant, muscle relaxant, remedy for migraines, etc. As the 1970 Controlled Substance Act was passed, which classified cannabis as a Schedule I drug. Now seriously ill patients that are prescribed or recommended to use this drug are in risk of imprisonment and going to jail, as well as their doctors. As you can see in this slide, these are all drugs that are FDA approved here on the left. Examples are like Viagra, Medicinal. In this slide here, we have primary suspects of death. For example, Medicinal, primary suspects of death are 196. Viagra has 18,101 primary suspects of death. Marijuana has 0. Note that even cannabis has not had a primary suspect in death, and it is still illegal. And all the prescription drugs that we consider as primary suspects are illegal. Cannabis is the perfect medication. It helps with anxiety, reduction, appetite stimulation, nausea, reduction, and pain relieving according to the 1991 report from the National Academy of Sciences Institute of Medicine. Are there alternative options to cannabis that have the same effect? Cannabis' main ingredient is THC, which is responsible for the high feeling that you get. They have developed a pill that contains THC within it to help synthesize the effects of cannabis. This pill is Medicinal, and it is FDA approved. Now remember, Medicinal has 196 primary suspects of death with THC. The regular, actual, natural plant has 0. We can see that this pill is ineffective because we can see that this pill is not as effective as cannabis. This is because along with THC, cannabis includes about 80 other cannabinoids that work together to develop that high feeling. Now let us compare cannabis to some legal and illegal recreational drugs. Jack Henningfield, PhD, did a study comparing popular drugs to cannabis. This study was presented in the graph shown here. Each drug was tested in 5 areas: dependency, withdrawal, tolerance, reinforcement, and intoxication. Dependency is the difficult level that the user is faced when attempting to quit. Cannabis has a low dependency rate of 1. Compare that with something that is commonly used and considered harmless, such as caffeine used in coffee, which has a higher dependency rate of 2. And right here we got caffeine. It's just so funny how caffeine is higher than marijuana. Marijuana is barely on the chart. Tolerance is the amount necessary to satisfy cravings of the drug, and once again, cannabis has a rate of 1. Reinforcement is the ability of the drug to get users to keep taking it and taking over for other substances. They're addicted to it. Cannabis is a 2 in this category, and nicotine, a legal drug, is rated at 3. Intoxication increases the personal and social damage a user may do and is considered a link between addictions. Cannabis has a higher intoxication level of 3, but as you can see, a legal drug such as alcohol has a 6 in this category. off the scales. We got nicotine, heroin, cocaine, alcohol is just off the scales. When marijuana is the lowest on the chart. Like I said, it said 0 and 1. It's not even on the chart. In conclusion, we can recall that what defines as a Schedule I drug. No medical uses and high potential for abuse can compare to what we talked about with the cannabis. Does cannabis have a medical use? Yes, cannabis does. We have heard from an actual cancer patient that used cannabis while going through his treatment. He said that no other drug can replicate the relief that cannabis gave to him. We have seen that the DEA's overjudge even believe that cannabis should be reclassified as a Schedule II drug. Now for the high potential for abuse, which is a possible issue for any drug and should be easy to control when cannabis is legally regulated.